I've been working here for 2 years, and it's been awesome. During COVID, we were able to partner with Ascension and help them out with their COVID patients because they were at capacity, so that was really nice, and that was great to see like full circle of getting everyone vaccinated. Yes, I received the Pfizer shot. I was very excited about it, and I didn't have any side effects. The difference is how they have to be kept. So the Pfizer one has to be in a certain temperature, and it has to be in a really expensive freezer, and even Oakland County is going away from using the Pfizer and switching to the Moderna because it's easier and we can get more of it to vaccinate more in the community. They're both 2 shots actually. So the Pfizer one is 3 weeks apart and the Moderna is 4 weeks apart. That's the only difference.
So today we're actually very excited. We're excited you're here so you can kind of see. We're giving the second dose of the Moderna vaccine for our employees and some of the employees, their family members. The struggle has been statewide with the shortage in vaccines. We were actually told originally, like Jonathan, our PACU charge nurse, had originally stated that we were supposed to get Pfizer, and then we were told Pfizer there was no more allocation for Pfizer. So then that's when we were told we were going to get Moderna. And yes, there were some areas that we had to look at in regards to how to store the Pfizer vaccine. We are very good relationship with our neighbors next door, Providence Ascension Hospital. So we were working on a process or a pathway with them, and then we were told we were going to get Moderna, and that also kept getting delayed. So we actually had requested an allocation, and we only received 50% of our allocation because of the statewide shortage of vaccinations. And so it has been something, I think, not just our hospital, but hospitals in the area, especially offices, and we found that surgery centers were actually in a gap. So I was able to help some of our peers in the area that work for surgery centers to get their anesthesia staff vaccinated with some of the allocation that we had, because there was no allocation at the time for them to get vaccines. So we try to really help what we had and make sure the people that really were on the front lines, to exposure, were vaccinated. We were very fortunate where we had an allocation of the Moderna vaccine, and we offered it to all of our employees. We actually had an excess amount of vaccine, so we were able to let the employees put a lottery individual into an opportunity to get the Moderna vaccine. So a lot of our employees were able to get their family members, their parents, their grandparents, the vaccine. So we're trying to help the community one person at a time. Over in the year of 2020, our surgical volume did decrease to about, it was put on hold when the governor said we needed no elective cases. And then we were at about a third to 2/3 of our normal capacity. And we're still recovering from that, because obviously with the COVID testing, because that was another thing that we went through, was you couldn't get enough tests to test your staff, your patients. So we struggled with that for a little bit, and now all of our patients that come into this building are COVID tested prior to their surgical procedure. So sometimes we did have a little bit of a barrier because we couldn't get the test, so that means we couldn't test our patients, and so it decreased our volume. So now we actually do drive-through testing here for COVID testing, and our results are within 24 to 48 hours. So we are able to test all of our patients, all of our staff, when needed at this facility.
I don't know if I really do what I was hired in to do anymore. Everything has changed. Everything has been just strictly towards COVID. We partnered with Providence when it was really heavy last year, and everything has changed. How we treat patients, our visitors, our conversations, how we work here, staffing, how even just onboarding new people, down to, we wear masks all the time when we're here. So that's just something new that feels normal and natural now. So we've actually come full circle from a lot of the staff, myself included. We all felt like we went through where we had COVID. We were treating patients with COVID, set up an entire COVID unit, COVID testing, everything related to COVID, and now we're kind of full circle back through actually vaccinating people so they are safer in the community and decreasing the spread of COVID. For me, it's a big thing to do our part in the community and do what we can. And so if we can vaccinate as many people as we can to help decrease those numbers, keep everyone safer, that's what's important to me. even people who are vaccinated, it's still important. Washing your hands, distancing, big social gatherings are still not a great idea. But just waiting, as we are waiting, the hospitals are waiting, everybody still has not had the opportunity to get the vaccine. So with that, we're hoping and we're very hopeful that a couple months from now, it'll open up and broaden to where we can provide that for, everybody, not just us, but the entire healthcare community.
With the Moderna vaccine, what happens is you get your first dose and then you wait a period of 4 weeks to get your second dose. We've had a lot of employees that have opted to get the vaccine, and we've had individuals that have opted not to. And it's all preference at this point. It's not a mandatory to get it. We do encourage all of our employees to get the vaccine, as the evidence out there has shown that it's in the 90s percentile of being effective in not getting the COVID infection. And a lot of we talk about side effects, and with vaccines that can happen. Usually they're very mild. And our employees, myself, I didn't have any symptoms from getting the vaccine, which was very encouraging. And so I'm hoping that I won't get any, because I'm getting my second dose as well today. And my grandparents also were here today, and they were able to get their second dose as well. She's just going to take down some basic information from me about myself. Right now she's getting out an alcohol swab, and she's going to make sure she cleans the area that she's going to give me the vaccine. All right. And honestly, that's all it is, right? Just one poke, less than 5 seconds. I wasn't even sure when she actually put the needle in, because it's very, very small and essentially painless. So I'm now fully vaccinated, thanks to Ashley.
So we recommend plenty of fluids before and after, making sure you're having good nutrition, getting a lot of rest. You can take Tylenol and Motrin as well to help with if you have any fever or fatigue or anything like that from the vaccination. It's all doable stuff.